Start with our first speaker, Dr. John Davis. Dr. John Davis is all over ARC, and he is going to be the discussant is going to be Dr. Santosh Bilde and Dr. Raji Sukumaran, both of you. Dr. Santosh and Dr. Raji Sukumaran, both of you are going to be discussant. Okay. The next you would have called, and the discussant, no.
May I start, ma'am?
Yes, yes.
So my video is on practicing surgeries at home, kitchen ophthalmic surgeon. So this is about how during the when you are stuck at home without access to a wet lab, you can still practice surgeries. This was because of the COVID pandemic and lockdown that this happened. So I'll just play from here. Owners have no financial interest in this presentation. The year 2020 brought a lot of surprises. The coronavirus attacked humanity. It rapidly spread across all the countries of the world. The world had to go into a lockdown. Elective surgeries reduced drastically, and surgical training practically stopped. Practicing in the wet lab became even more important. Welcome to Anju's Kitchen. You can simulate the feel of a microscope by putting a smartphone between two boxes with the video mode and flash on. This gives magnification, illumination, and allows you to record your surgeries. A tomato with needle and thread can be used to practice superior egress bridal sutures. A SICS tunnel can be practiced on the boiled egg using a crescent blade, even a side fold, and also a keratometry. If you have a magnifying loop, you can use that instead of the smartphone microscope. Make a cystitome by bending a 26 gauge needle. You can practice capsulorhexis on the skin of a tomato which has been kept in the microwave for 5 to 10 seconds. You can also use that smartphone microscope simulator and an onion. Similarly, you can also do a can opener capsulotomy. Nucleus delivery can be practiced with metal wire to take out a seed or garlic, for example. If Zipco is not available, a syringe can be connected to a tube and pick up tissue paper bits from a bottle. It would definitely be better to practice irrigation aspiration with a Zipco cannula. Bits of tissue paper can be aspirated from each bowl. For phacoemulsification, a piece of potato can be cut out. This can be cut in the shape of a cataract nucleus and using a pencil and needle can be chopped. If available, loading of foldable iodes can be practiced. Along with the proper injection of the iodes. Other than cataract, trabeculectomy flap can also be practiced on the boiled egg. Incisions can be made and the flap can be raised. A cut grapes fixed on a toy can be used to practice suturing. Tomato can also be used for suturing practice. Hope this guides you to set up a wet lab in your kitchen and practice eye surgeries at home during this pandemic. Thank you.
John, that was as usual an excellent presentation. The value of this presentation is that it does not involve any costly equipment.
Yes, sir.
Everything is available at home, and you have proven that even the people in the learning stage also can practice all this at home. Congratulations, very good.
Thank you, sir.
Yeah, as always, out of the box thinking by you. I have observed you last AIOC also.
Thank you, sir.
So well done, actually. Very good.
Thank you, sir.
Keep it up.
Should we go on to our
Can I ask him some question?
yes.
Regarding the texture and all that, the way you said the keratometry and all, is it the same feel that you have it otherwise, or it is quite different?
The
Because if
texture
you're
is
learning
definitely
it,
not the same, sir.
yeah. So
Dr.
that is
Vikas.
only, I think, a shortcoming out of it. But otherwise, it's a fantastic
Dr.
idea the way we
Vikas?
go
Yes,
about
sir.
it.
I would like to add that if you have access to eyeballs, that would be better. So if you have human eyeballs, best. If you have, say, pig eyeballs or goat eyeballs, that will be good. But you cannot do all this while you are at home, because at home, getting an eyeball and practicing surgery is frowned upon. So if you are at home, stuck in the kitchen, you don't have access to wet lab, anybody can do this. You don't have to gross
Tactile
out
feel is
anybody.
not there.
As a starting point, it is very good because once at least you get a feel of how to hold it and all. But
Yes,
of
sir.
course, definitely later on, this is the first step, but a very fantastic
Thank
idea.